Hello and welcome to our bi-weekly community engagement webinar. Today is Thursday, March 11th. My name is Deborah Volleson and I'm the Director of Community Engagement here at Kaweah Delta. And as usual, I am joined today by our CEO, Gary Herbst. And we're going to answer a few of your questions. We're going to share some information with you about the happenings here at Kaweah Delta. And feel free to email, chat in while we are live, and we will get to your questions. Gary, welcome.
Yes, thanks, Deb.
It's good to see you.
Yep, good to be seen.
In
good
2
to
days.
see you.
Well, thank you. You didn't have a comment about my hair today, so I appreciate that. Thank you.
I was ready for one, but then I refrained.
Yeah. Well, Gary, we are coming up on our 1-year anniversary of COVID hitting the halls of our hospital. And we talked about it a little bit a couple of weeks ago that we were, looking forward to this day, and we were hoping that our numbers were going to continue in the right direction so that good things could be happening. Mm-hmm. And I know you're going to share hopefully some good things today.
I have lots of good news.
Okay,
today.
All right, good.
Yeah.
But we're planning a commemoration of our 1-year anniversary tomorrow. It's actually on Saturday, but we're celebrating it tomorrow. Not really celebrating it, but we're commemorating some of the things that we're just really celebrating our staff for the amazing way that they stepped up to the plate. And you can't see in this office, but right now there are thousands of cookies that are going to be delivered throughout the district tomorrow. And they have this cute little sticker that says hero. It's been a year. Hashtag it's been a year.
Right.
So it's been a year.
It has. Yeah, right. It was on March 13th, 2020 was when former President Trump officially declared a national emergency. And it was on that same day that Kaweah Delta declared a local emergency. And we activated what's called the Hospital Emergency Incident Command System, which is a nationwide disaster response plan that all hospitals follow across the country. It's very organized, structured, and a component of it is the creation of a command center. And so we, on that day, Friday the 13th, we actually created the command center in the Kaweah Wing conference room, and we operated it 24 hours a day, 7 days a week for probably the first 7, 8, 9 months of the pandemic. And we definitely are not celebrating the 1-year anniversary, but commemorating it, recognizing it, acknowledging it. We will actually, tomorrow at 11 o'clock, we will have a moment of silence. Where we will honor and remember 4 of our fallen Kaweah Delta family members who passed away from COVID, 3 of our employees and 1 of our providers, a physician assistant. So it'll be a somber, solemn day, but at the same time, we will we'll recognize just some incredible work of our team, of our family.
Yeah, because, in the past, we do drills all the time. What, do we have to do like 1 or 2 a year?
Yes.
Where we do drills, but it's like an accident or, a large trauma coming in. I don't know that I've ever been a part of a pandemic drill.
I doubt anybody alive today, although I think I mentioned that I saw early on in the pandemic, I watched a 102-year-old woman living in Italy that was being interviewed. She was a COVID-19 survivor, and she was drinking a bud. But she also was alive during the 1918 pandemic. So she'd actually lived through 2 pandemics.
Wow.
But no, you're right. We practice for disasters all the time, and we usually call them tabletop. Because we kind of go through the motions. We're play acting, but we try to make it as real as possible. Right. And we invent some creative type disasters, the dam, bursting, major earthquakes. We have done a flu pandemic. We have done an exercise in that, but Obviously, never have we actually lived through it, and it's been quite an experience.
Well, now we know how, and now you know that your team's going to just rise up.
Yeah, but I don't want to do it again.
No,
That's what
no,
you're
no, no.
suggesting. That now we know what we're doing, so when the next one comes, we'll be ready.
No.
So
I hope this is a
no.
once in my lifetime kind of thing.
Yeah, exactly.
Okay, so let's get into the numbers.
All right.
Because we're hoping
They're
for
huge.
good news.
Well, they're very large numbers, and then they're very tiny numbers too, which is it's a good thing. So I'll start at the state. We've now performed 50.2 million COVID-19 tests, of which 3.5 million came back positive. So at the statewide level, the cumulative positivity rate over this last year is holding right now at 7% even. The state is reporting a 14-day positivity rate of only 2.3%. So of those millions and millions of tests that are being done, at least over the last 14 days, only 2.3% of them are positive. So the rate of transmission is definitely declining. If you look at the state's positivity rate just over the last 7 days, it's at 2.8%. So up slightly from the 2.3%, but very close. And the state is seeing 8.1 new cases every day per 100,000 population. There have been, or right now, there are currently 4,119 COVID positive patients that are in a hospital somewhere throughout California. Of them, 1,064, so roughly 25%, are in the ICU. And that number has held pretty steady, the percentage of hospitalized patients that required that critical care. Sadly, now we are just shy of 55,000 COVID-related deaths across California, and that represents a COVID-related death rate of 1.6%. So of the total population, the 3.5 million that have tested positive, 1.6 of them have passed away from the virus. That translates into 137 deaths per 100,000 population. So just kind of keep that number in mind, 137 when I move to the county here shortly. There are 58 counties in the state of California, Tulare County being one of them. Right now, 34 of those 58 counties are still in Tier 1 purple, widespread transmission, and under the governor's blueprint for a safer economy, that's the most restricted, the most closed down. So that number was 54 not too long ago. 54 of the 58 counties were in Tier 1 purple. So we're now down to 34 counties. Unfortunately, but I got good news, Tulare County today is still Tier 1 purple, so we're one of those 34.
You looked at me and said, "I've got good news." And I
do
was like,
have-
"We're moving out."
Because I saw the look on your face. So 20 of those 58 counties have now moved into Tier 2, red, less restrictive. There's actually 3 counties that are in Tier 3, orange, and 1 county, Alpine County, up north near Sacramento, is actually in Tier 4, yellow, which is essentially wide open at that point. So schools, gyms, movie theaters, restaurants, everything.
How many people live in Alpine County?
I don't know, but after I announce that, maybe more as we move out of Tulare County up into Alpine County.
We're moving to Alpine.
Yeah. California has now administered 10.8 million doses of vaccine. So I believe I read in the paper this morning that that's about 12% of the eligible population. And when I say eligible, meaning those that are older than 16 years old. So I'll talk about the eligibility here next, but only those that are 16 years of age and older are eligible to receive a vaccine at some point. 12% of those that are older than age 16 have now been vaccinated in California. So I'm asked often.
We have a fact checker here.
A fact checker. So there are 1,039 people that live in Alpine County, and I'm jealous of all 1,039 of them. So thank you. I don't know if that was Kelsey that ran that in, but thank you, Kelsey. So everybody wants to know, when will I be eligible to receive the vaccine? So right now, both Phase 1A and Phase 1B have been opened up. So Phase 1A was healthcare workers and those residents of long-term care facilities. So like nursing homes, assisted living facilities, they were the very first that were eligible for vaccination. Then the governor moved us into Phase 1B, which opens it up for anybody in the food and agricultural industry, and this is regardless of your age. So 16 years older and above, but you work in food or ag, or you work in education, teachers, or child care, and all first responders, so fire, police, folks in those professions. So you could be any age and be eligible, as well as anyone in any profession, working or retired, that is over 65 years old. So they are also currently eligible and can get vaccinated. Come this Monday, March 15th, we will now be able to vaccinate anybody of any age above 16 in any profession or retired. So essentially, we can vaccinate anyone that we think is at high risk of contracting the virus and becoming really sick from it. And so the state has, and these are essentially healthcare providers make those decisions if somebody's at high risk. So from a state standpoint, it means that people that have cancer or chronic kidney disease, stage 4 or higher, chronic pulmonary disease or COPD, we have difficulty breathing, Down syndrome, you're in an immunocompromised state from, say, an organ transplant, pregnancy, sickle cell disease, heart conditions such as heart failure, coronary artery disease, or cardiomyopathy, severe obesity with a body mass index greater than 40, or type 2 diabetes. So if you're any age with any of those underlying chronic conditions, come Monday, you will now be eligible to receive a vaccine. And I believe it does have to be ordered through, again, a healthcare professional, but that could be Kaweah Delta. Kaweah Delta could be your healthcare professional. So, so that's good news.
So it says pregnancy on there. I thought it wasn't. I thought they weren't encouraging pregnant women to get it.
I know there's been a lot of hesitation, but when the vaccines first became available, the American College of Obstetricians and Gynecologists came out solidly in favor of it, and they really encouraged pregnant women to get vaccinated.
Okay.
Yep. Okay, so that's where we are at the state level. At the county level, we've now conducted 450,000 COVID tests, of which 48,432 came back positive. So that's a cumulative positivity rate of 10.8%, higher than the 7% experienced statewide. So now we start getting into the good news and the tinier numbers.
Okay.
So the county reported, and every Tuesday is when the state recalibrates a county's condition. So on Tuesday, the county reported that our 7-day positivity rate has now dropped down to 4.4%. Okay. That is the lowest positivity rate reported in the county since March 26, 2020. So all the way back almost a year ago, really at the beginning of the pandemic, when numbers were first beginning to rise, we are now at 4.4%. Not seen since that March 26th date. Just 8 weeks ago, the county reported a positivity rate of 19.7%. So it has plummeted over these last 8 weeks. At 4.4%, that puts us in Tier 3, orange. Yes.
So could we jump?
No. No, because as I'll say in
Wouldn't
a
that
moment
be
here,
awesome?
there are 3 metrics for reopening. And the worst metric, where you are performing the worst, is the metric that determines what tier you're in.
Okay.
So not the best. If it was the best, like what you were suggesting, we would be in orange. Another positivity rate is the health equity positivity rate. And as I've shared in the past, the entire county is broken up into 4 quadrants based on their health equity indicators. So that would have to do with poverty levels, access to care, different health factors, prevalence of diseases and things of that nature. So in terms of that area of Tulare County that has the lowest health equity measures, so we have to achieve a positivity rate there that's also at least equal to or better than the 8% positivity rate for the entire county, everybody. And that positivity rate now is down to 5.9%. So again, well below the 8% that's required, and that 5.9 would put us in Tier 2 red. So not as good as Tier 3 orange, but definitely better than Tier 1 purple. So now the bad news, although again I'm projecting that it's going to change here very quickly. That's the number of daily new cases per 100,000 population. So I mentioned that statewide it's at 8.1. For Tulare County, it's at 9.5 right now. So over these last 7 days, we're seeing 9.5 new cases per 100,000 population. We have 484,000 people. You need to be below 7, so 6.9999. You have to be below that to move from purple to red.
Okay.
Given the way that the numbers are moving, we are, what do I say, confident, definitely hopeful, and optimistic, and pretty confident that if we continue what we've been experiencing, that we will likely fall below that 7 by next week. But there's good news, even if we don't. If we just stay at 9.5. So I guess a couple weeks ago, the governor publicly expressed his concern about those poor communities throughout the state, that health equity index. And so he made a decision to set aside 40% of all the vaccine that the state had to target it to those poor communities so that there would be equity, that they would have as much access to the vaccine as maybe the more affluent areas or more urbanized areas. So he set out a goal to vaccinate as quickly as possible 2 million people in that quadrant that had the poorest indexes. As of today, we're above 1.9 vaccinations having been given. Probably by tomorrow, we'll hit the 2 million mark.
How do they do that? Do they choose the areas and go to those areas?
They do it by zip code. So every single zip code in California, we know all these, I think, 21 different health factors, health indicators. And so the state, identified the 25% of zip codes up and down the state that had the worst health indicators. And so he is targeting vaccines to get to those areas. And but he set a goal to hit 2 million. And once he hits 2 million, then he will increase the threshold of daily new cases per 100,000 from 7 to 10. So it is highly likely, well, it's a given that we'll hit 2 million tomorrow. And then most likely over the weekend or on Monday, the governor will announce that he's taking that threshold to 10. So we are already there. At 9.5, we are below the new threshold of 10. And that means we have met all 3 metrics that at least will allow us to move into red Tier 2. And we're again, highly optimistic that that will be announced next Tuesday. Okay, so that's my really good news for the day. I guess my sad news is we've also, obviously, we've had a lot of death in Tulare County. We currently still rank fourth out of the 58 counties statewide in terms of deaths per 100,000 population attributed to COVID. So we've had 781 deaths. It also equates to 1.6% of Tulare County residents that have contracted the virus, so it's identical to what we've seen statewide. But it translates into 161 deaths per 100,000 population, so above that 137 that has been experienced statewide. And then lastly, I'll end the county report on a positive note. The county has now administered over 62,000 doses of the vaccine, and they still have 36,000 in inventory. And that's it, not just the county, that's county-wide. So there are 28 different providers, including Kaweah Delta, that have signed on with Blue Shield to become a vaccinator. So we've all executed contracts that will then prioritize us for receiving vaccines. So among all those 28, as well as the county of Tulare, we still have 36,000 doses of vaccine, and we're continuing to receive vaccine on a weekly basis. So that's the county level. At Kaweah Delta, the numbers also continue to be vastly improved. We're still pretty busy, but as of this morning, our occupancy rate was at 82.6%. So a little bit of elbow room. 19 of our ICU beds are open. 22 of our ICCU beds are open. It's still tight in the medical surgical area. Only 7 of our 249 med-surg beds were available this morning, but that's before a lot of discharges will occur throughout the day. I mentioned that the 23-bed Nicu on the 6th floor of the Asiqua wing has been fully restored back to being a neonatal intensive care unit, and the 12-bed pediatric unit that was being used for adult overflow is now empty, and it will next week, I believe, as we start moving that back to being a pediatric unit. So pretty much all of our surge beds, like the endoscopy and everything, we've been able to restore those back to their normal purpose, which is a really good sign. And then the best news of the day is that as of this morning, we only had 26 COVID positive patients that were in the acute medical center. Awesome. 7 of them in the ICU, 6 of them on ventilators. But to go from 170 roughly 8 weeks ago down to 26, and the number again has been falling each and every day. So that's incredibly positive news. And then the last thing to report is, while we've had, almost 1,200 of our employees that have contracted the virus over the course of the pandemic, only 27 are still out recovering from COVID, and we expect them to make a full recovery and be back to work soon. So
that's great. So the lowest we've ever been during this year was we had 14 COVID positive, and was that in June or July?
I think it was actually in October. It was very close to Halloween. Okay. Because we were feeling good.
We were feeling good.
We were feeling good.
We really were.
And then obviously all that changed after Thanksgiving, and the numbers started soaring and finally peaked at 170. Held there for a while, but then steadily have been coming down. And again, I commend our community. I know it made for a very difficult Christmas and New Year's and Super Bowl, but you all did a phenomenal job, practicing safety and staying well and staying out of the hospital.
Okay, so here's the magic question: when is Lifestyles going to open?
So we believe it will be next Wednesday.
Next Wednesday.
Yes. So
because we're hoping for a great announcement on Tuesday.
Correct.
And okay.
Correct. Yes. So we've been a very compliant organization throughout this pandemic, following the governor's executive orders, working closely with the county and everything. And it's been very difficult because we know Most all of the gyms throughout Tulare County have been open. It's frustrating. We've actually lost 2,000 members since the beginning of the pandemic because we closed, and they went and joined other gyms that decided to stay open, and so it's been so tempting. It's still so tempting.
Yeah.
But we want to be, respectful to the county and continue to, I guess, be the standard bearer
Right.
for following the rules. So we think Tuesday, in fact, unless something was to dramatically change, because again, I think the daily average case threshold will have moved to 10 by then, and we will fall into the red, which allows gyms to be open. Now we do have to restrict capacity to 25% while we're in the red tier, so we fully intend to do that. We will be disinfecting constantly, and we will be asking the members to wear a mask even while they're exercising. The swimming pool will be open. That'll be the one exception where you don't have to wear your mask. But they'll definitely be distancing, and I don't know yet how, if they're reserving lanes, things like that.
Yeah. Well, that's good news. And, it's been really hard for people's mental health to not go to a gym because, so much plays into that. Being able to
Yeah.
stay active, stay, healthy. Quarantine 15, we've thrown that out.
I heard it moved to quarantine 20.
20.
COVID,
the
COVID
longer
20.
it drags out, the
know.
higher that number is
Yeah,
going to be.
yeah.
So what about, the COVID collection site was there in that lane that you
Right.
could go underneath. Where is that at now?
So yesterday it moved back to Court Street.
Okay.
So the urgent care center on Court Street, which was originally it was over on Floral, obviously between Kaweah and Main, and then we eventually moved it to Court Street, and then not too long ago out to the Lifestyle Center. But with the Lifestyle Center preparing to reopen, we moved the collection site back to Court Street.
What about the day camp where we're taking
So we're
care
going
of
to
kids?
continue to operate the day camp. I don't know how much longer. Parents, we've been, surveying them, and they definitely want us to continue to do that. But we're going to kind of move them out of the gym part, the exercise areas of the gym, and move them into the conference room. So we have 3 conference rooms that you can separate the walls. You can slide the walls out to make it into a big area. So the kids will be moving in there.
Okay, fabulous. So you talked about the number of people in our community that have been vaccinated. So we've covered that one. So what are your thoughts on the new CDC masking guidelines, easing restrictions for people who are fully vaccinated?
Well, I'm glad to see it because I think I've mentioned I was so disappointed to hear that the CDC and Dr. Fauci and all the other experts were saying, well, even after you're vaccinated and you're 2 weeks out from your second dose, and so your antibodies, your immunity should be really strong, you have to keep wearing a mask, and you have to keep doing everything you were doing. And I go, well, then what's the benefit of being vaccinated? And I think it's really, and I've said this, being vaccinated does not prevent you from becoming infected with COVID. And we don't know if it prevents you from transmitting the virus to somebody else. And still only about 60% of our employees have been vaccinated. We still have 40% that are going to choose not to be vaccinated or still kind of waiting. And that's pretty much what we're hearing across the nation too. So you're still going to have a big part of the population that's just not vaccinated, and so they don't have the protection of staying out of the hospital. But I think the CDC, where they've come out and said, okay, if you have a group of people and everybody's been vaccinated, although this is some of the controversy, is like, well, what if I wasn't vaccinated, but I've had the virus, so I have natural antibodies, I have natural immunity. Can I gather with people that have been vaccinated or with other people that have natural immunity? I don't think I saw them comment on that. I just saw the CDC say for those that are fully vaccinated and are 2 weeks out, that you can gather. But then I think they said, but limited only to one family.
Yeah.
You know, you could be your immediate family plus people from one other family that are vaccinated. And I don't quite understand that. And in fact, I was watching the news either this morning or last night where there was a physician that was saying that makes no sense whatsoever. If you're vaccinated, you should be able to gather with anybody that is vaccinated as well. Again, you know, you could have people that have the virus in that group and could spread it, although they're studying, does the vaccine really stop transmission or greatly reduce it? But right now they don't know enough, so they're still, you know, you could have a group of people that are gathering and somebody is sick with the virus, although they're asymptomatic, and they could spread it to somebody else. But if you're all vaccinated, it is 100% effective at preventing COVID death and 95% effective at preventing serious illness from COVID. At least, you know, Pfizer and Moderna. Johnson & Johnson's about 75% effective in preventing serious infection and hospitalization, but it's also close to 100% in preventing COVID-related death. So I guess my short answer is wonderful to see the CDC, but I'd like to see them open it up. I think we're going to see that, you know, in the coming days and weeks, just more and more pressure to do that.
Right. So have we seen a vaccinated person at our facility that has gotten the virus? Do you know if we've seen that yet?
I don't know.
Okay.
Yeah, I think I asked that question as we hospitalize patients with COVID. You know, the 26 that are in the hospital today, were any of them vaccinated, or did any of them have COVID previously? I don't know the answer to that, but it'd be a great question to ask, because when we, I think I mentioned last year, we hospitalized roughly 400 patients that were positive with the flu, and they were hospitalized because of their flu related condition, and 95% of them had not received the flu vaccine. So the flu vaccine works very similar to the COVID vaccine, as it doesn't prevent you from getting the flu, but prevents you from becoming seriously ill or needing to be hospitalized. And people die of the flu. Tens of thousands every year die of the flu. And the flu vaccine is very effective in preventing flu-related death.
So when Texas and Mississippi made the decision to just open up last week, I wonder if there's any kind of increase in their numbers. I haven't.
I don't
Have
know.
you seen it?
I haven't, but
Yeah.
I'm certain we'll hear about it.
Well, I'm sure
Yeah.
if there had been, it would have been all over the news.
Yeah.
Okay, so just a couple of surge questions. So if, and I'm just asking you to foresee into a future that we don't know, but if another surge happened, okay, would we shut back down, or would we just learn to adapt with precaution?
I think it depends on the size of the surge. You know, the surge that we experienced in the winter in December when we had 170 patients and we were also 95% occupied, we didn't have a choice. Because you think about it, we shut down surgery right when the pandemic broke, bracing ourselves for this massive surge that was going to come that never came. And so we waited and waited and waited, and the numbers really never escalated. So we opened elective surgery back up on May 18th. Then we got hit with a surge in late July, hit 91 COVID patients. We had to shut down elective surgery. Opened it back up in the fall, only to have to shut it down again in December when we hit 170. Today, surgery is fully open. There are 0 restrictions right now. But if we got hit with another massive surge, which I don't think is going to happen because of the vaccines and because of the natural immunity that people are...
There are whispers of that fourth surge.
You know,
but then they've kind of gone away.
Yeah, they were whispers because of the variants.
Right.
They were afraid that, you know, the Brazil and South Africa and the United Kingdom variants were going to cause this resurgence. But the more and more I'm reading is that they feel that the vaccines are pretty effective against these variants. And so we're not seeing greater hospitalizations. And so I'm glad those people that were doing that whispering have turned out to be wrong at this point. But, you know, the word surge just, you know, connotes large numbers. We think COVID is just, it may hang around, we don't know. We don't know if it's going to be like SARS-CoV-1, which came and went, and we've never heard from it again, and we never developed a vaccine, and this is SARS-CoV-2. And will it go that same way, that just dies off? Or will it come back every year as like a seasonal virus, and we're getting vaccinated every single year? So at some point, you're right. If we just have COVID, it'll just become a condition that we take care of. It will just absorb it into our normal processes. And, you know, airborne illnesses or viruses like measles and tuberculosis, and those are always out there. And when we take care of those patients, we put them in negative pressure rooms, we wear N95 masks, we do all the things that we're doing for COVID. And so that will just become part of the normal treatment for them. So.
So what about our visitor restrictions? I know we review those often, so.
Right. So we still have in place right now, you know, the modified visitor policy with an 11 to 1 hour slot, and I think a 4 to 6 or 5 to 7. So just yesterday we had our weekly sections chief meeting, and Emma Mosier and Rebecca Foster, who kind of lead the visitation. We have a committee for almost every aspect of the pandemic. So we have a visitor policy committee that already is talking about going back to a more normal 8 to 8, but maybe, you know, just one visitor at a time as opposed to, or maybe two, but not an entire family. So yeah, it definitely will be changing. If we see the numbers stay where they are, you will see an opening up of that visitation policy.
Okay, that's great. All right, let's go back to the vaccine. So we are now offering the vaccine at our urgent care on Court Street.
Yes.
And so the question came in, how do you sign up to get vaccinated at the urgent care? So if you want to walk them through our website, you and I walked through it together yesterday.
Sure. So, well, first, you may recall that when that was, remember The Secret? They would never tell me the date because they were afraid I'd blabber it. So in February, kind of the latter toward part of February, we started doing COVID vaccinations at the urgent care site, but it was limited just established patients of our various outpatient clinics that were at higher risk of contracting the virus and potentially being hospitalized. So we worked through that patient population and now are offering vaccinations to the general public. Now you have to be in one of the eligible categories or groups that I described earlier, but if you want to be vaccinated by Kaweah Delta and you're eligible for vaccination, if you go on the normal kaweahdelta.org website and you kind of scroll down to the bottom.
The testing, the COVID testing will be first.
Right, COVID testing will be first. So if you still want to, if you want to get COVID tested, we're still doing that testing. But then you'll see COVID vaccination. So you move down there and there's a couple buttons that you can select from that you can click on. One is if you are eligible. So you're in one of those eligible categories. You can click on and see what appointments are available. Now, since we're only vaccinating at the Court Street facility, that schedule fills up pretty fast. When Deb and I went on it yesterday, it said all appointments, taken. But so you can click on there, and again, if you're eligible, you can make an appointment. If you're not eligible, though, then you go down a little bit further, and it says non-eligible vaccinations, and you click on that, and then there's a form that you fill out on there that with your name and contact information, and then we will contact you when your age group or your profession or whatever, as we move through the different categories, and there's still other phases, then you'll be contacted and scheduled for an appointment. So that's if you want Kaweah Delta to vaccinate you, and going onto the Kaweah Delta website.
And even if, let's say, even if you are eligible and there are no appointments, go down to that not eligible box and put your information in, and they'll contact them.
Yes, that's right. Thank you. So it's not just, so if you are eligible too, not just even though it says non-eligible, if you are eligible but you couldn't find an appointment, yes, go down and fill out that form. You'll put in those demographics that make you eligible, and then when appointment is available, they will contact you for that. So thank you for that. The other way is through the state's platform called My Turn. And so it's myturn.ca.gov. So if you go to that website, that's also where you can schedule an appointment, and all 28 enrolled vaccinators in Tulare County, as well as the county itself, the county health department, it's mass vaccinations going on at the Ag Center or COS. That's how you make an appointment for one of those sites. And so there probably are more openings available. One of the things it's a bit frustrating is that it's a statewide application. And interesting, my wife's cousin called us a few nights ago. She lives in Stockton, her cousin, but she was calling to let her know that she has an appointment to get vaccinated on Saturday at CVC here in Visalia. I think it's over 200 miles. It's a 2.5 hour drive to Stockton from Visalia, and but she went on My Turn, and Visalia was picked for her as the most next available appointment. So I think that's a bit frustrating that people living in San Joaquin County can come to Tulare County and use one of our vaccines.
Right.
Blue Shield said they were supposed to shut it down to a 50-mile radius, but apparently that's not happened yet.
So does that count as a county vaccination for us or a county vaccination for San Joaquin County?
I don't know. Yeah. Interesting question. Because we're trying to track what percentage of our residents have been vaccinated. Yeah. So, I don't know. But if you go onto that My Turn website, hopefully you find appointments available here, in the local community, but you might find appointments outside of Tulare County as well.
Yeah, and those events are really smooth.
They are.
They have got it down. You drive up, they check you in. You just stick your arm out the window. It's really a smooth process. Okay, so it is March 11th, and February financials should be released. I don't know if they've already been released to you as the CEO.
Unfortunately, they have.
Okay.
So February was, not a good month. Surgeries were still very much restricted. Folks are still apprehensive about coming to the hospital or seeking health care. So a lot of our outpatient sites, volumes were way down there. We're still, we're an incredibly busy hospital, but, surgery is, again, the financial lifeblood of any hospital. So unfortunately, our net patient revenue was $5.4 million under budget. Our expenses were $1.9 million over budget. So we ended up posting an operating loss of $4.5 million. That's the bad news. The good news is we did have additional federal stimulus funds that we were able to apply against that loss, about $3.5 million worth. So after that adjustment, we ended up with a $1.1 million operating loss for the month. Year to date, before stimulus funds, so our fiscal year runs July 1 to June 30th. So through the 8 months ended February, we have a pre-stimulus fund operating loss now of $29.9 million. But we have $26.5 million of stimulus funds. So our cumulative adjusted operating loss through that 8-month period stands at $3.4 million. One of the fascinating things that Melinda Tupper, our CFO, mentioned just the other day is we are $16.6 million over budget in our total operating expenses through that 8-month period. And she said close to 13 million of it is directly associated with COVID. So the expense of PPE, of drugs, oxygen, all the other therapies, additional, nursing, having to use travelers, having to use state-sponsored travelers, just the longer period of time that COVID patients are staying in-house, really is what is creating the financial challenge that we're experiencing right now. So
Interesting. So I always like to kind of add a question to make you human. A lot of people look at you as the CEO. I know our employees,
subhuman,
you're the
is that-
CEO, and But so we asked our staff to submit changes that they have made since COVID started for their teams. And then we also asked them to give us information on what has been a positive change that they've made that, they hope to continue into the future.
Right.
So you've made a lot of changes this year. And so I know a couple of weeks ago I asked you if you could go back and do anything different, what would it be? But this is a little different. Of the changes that you've made personally, whether it's at home or here at the organization, what is something positive that you've really gleaned from this pandemic that you will carry forward?
So I'll start, personally, I got up at 5:15 a.m. this morning, and I worked out in my new gym in my garage. So my wife and I we broke down and bought a treadmill, and it won't be in our bedroom where we just throw clothes over the top of it.
Right, it won't be a hanger.
Right, a hanger. It's in the garage, and we bought one of those Total Fitness or Total Gym. Chuck Norris, he's the guy that sponsors it or promotes it on television. So I walked 3 miles fast on the treadmill this morning, did some weights and stuff. So I hope that habit will continue. I don't have any more excuses. I'm definitely a fan favorite of the Lifestyle Center, and that will still be my main place where I work out. But I now have an alternative that I don't intend to take down once the pandemic's over. On a professional level, it would be this. It would absolutely be this. Never did I imagine that I would spend so much time and enjoy it so much interacting with our community, sharing information about Kaweah Delta. I've done 5 town hall meetings. This is our 40-something community broadcast. I've done dozens and dozens of television interviews now. And
do you kind of like the Hollywood feel, Gary? Is that what you're saying?
No, it's not my nature. It's not really. I always remind people, I was an accountant before I was a CEO, and so we tend to be more introverted. And the employee huddles. It's professionally, it's definitely helped me develop, and become more comfortable in front of the camera. But just engaging with people, just being able to the questions, being able to answer questions from the community and from our employees every week, every 2 weeks, and it makes me feel that Kaweah Delta is a deeper part of the community now, and people know who we are more now, and And the transparency, you know, that was kind of, that was going to be my, you know, my mantle. That was when I became CEO, that was the commitment I made personally. I made it to the organization. I made it to the community. There are going to be no secrets. You're going to know everything about Kaweah Delta, the good and the bad, you know, where we're not performing at the level we need to perform at, you know, I'm going to share that. And so, yeah, that's a change that I don't intend to remake. I mean, we'll continue to do community broadcasts, we'll continue to do employee huddles, and we'll look for more and more ways that we can connect with our community.
It's really interesting because I've had people tell us that they really felt like you were the voice of truth. I mean, last year was a horrible year politically, it was a horrible year just pandemic-wise, and there was so much information being thrown at us, and you know, some of it was fake news, some of it was real news, and you really didn't know what to believe. And so a few people just said, we know when you do your telecast that Gary is the voice of truth. And whether it's, you know, whether it's the hospital is financially in dire straits, or, you know, the numbers were the numbers.
Right. Yeah, and I actually, I've spoken to other hospital CEOs in the state, and they're like, I can't believe you're sharing that information. I can't believe you're talking about deaths in the hospital and their underlying conditions, and how many people you have in the hospital with COVID, and you're telling them the number of employees that have COVID, and when your employees have died, and I can't believe you're sharing that information. And I said, well, I came to the conclusion that it's not a HIPAA violation. I'm not sharing, you know, private health information, and our community wants to know.
Right.
And they want to know when, you know, when it's getting bad, when it's getting good, and so for me, it's just been easy. And I always like when you say, well, Gary, you're so calm, you know, and your calming presence just helps us think that we're going to be okay, you know, and that. I'm just so glad that's just who I am. That's, you know, I'm just, you know, have that calmness to me. And
well, I'm going to ask you tomorrow in the employee huddle, because I have talked repeatedly about your calm demeanor. But was there ever like a moment of panic for you this year?
Oh,
where you really just had to step back and
I worry
say,
a
okay.
lot, yeah. And I feel really tired today. I slept horribly last night for whatever reason.
Maybe it's all you're working out.
No, I don't think so. I don't think so. Just, a lot on my mind. But, you know, I wouldn't say I panicked, but I definitely have fretted and worried about our staff. You know, that's my greatest worry. Yeah. I worry about, you know, our financial performance, our financial position, because there's so many things we still want to do, new services. We had an executive team meeting this morning, and you know, between Mark Mertz and Doug Leeper, they're talking tens of millions of dollars in capital needs for investment, continued investment in information technology and buildings, and putting roofs, repairing roofs and parking lots. And you know, there's just so much that we still want to do, and yet we're in this financial condition right now that causes me grief. Yeah. But again, from the very beginning, it's always been my worry about our staff, and not wanting them to get sick, but also just the exhaustion. And but it didn't cause me to panic, it caused me to focus. Certainly. Yeah.
Well, there are a few members on today that we were part of a community relations meeting where one of our executives, we were talking about the state of emergency and when we were going to have to ration care. And we were just in tears over that. And I started to panic a little bit. I was like, okay, this is a tearful meeting where, you know, our hospital was going to a place we had never been before. That's scary.
Yeah.
That's scary.
Yeah, and I was definitely scared at that time too. To sit in that triage command center and practice rationing care, practice who comes off a vent, who doesn't get admitted, who are we going to send home. Just, you know, trying to contemplate that, and fortunately, it was just practice, and it ended there, and it never had to actually happen. But you're right. I mean that. It was a scary very disheartening time.
Yeah, and when you're talking about the capital budget, really, healthcare needs don't stop for a pandemic.
Right.
And you got to experience looking into the future last night at a foundation campaign kickoff with Liz Wynn and her team and foundation board members. And so it's just amazing when you're around community members who are stepping up to the plate
Right.
and saying, you know, you need this and this and this, and we're going to help you get there.
Can I talk about that real quickly?
Yeah,
I
we
don't
have a
know
couple
my
of
time.
minutes.
Okay.
Yeah.
Yeah, so last night at the Sequoia Regional Cancer Center, our hospital foundation board and some of our Kaweah Delta board members and our exec team members, Deb and I were there, and it was the kickoff to the foundation's new, what they call the 2021 Modernization Campaign. And they want to raise about $1.5 million. They have 6 specific projects that they want to fund. One is halo bassinets that allow a mom that's delivered by C-section that is still in quite a bit of pain and everything, difficult to hold her baby, and so these bassinets make it easier for the mom to reach out and hold that baby, and then endoscopic ultrasound technology, so letting our gastroenterologists like Dr. Shea, Dr. Pua, to be able to do these better assessments of patients that have gastrointestinal or lung diseases, to be able to see better. The Ambrosia Cafe and Gift Shop, which unfortunately were victims of the emergency department expansion project. So when we started working there and we had to close the waiting room in the regular emergency department, we turned the Mineral King lobby and the gift shop and the Ambrosia Cafe into essentially the ED waiting area. Yeah. So we're going to create this new modern kind of integrated cafe and gift shop and area where people can sit and gather and enjoy,
because
a meal
the ED waiting room is now going to be in the new ED, which is going to open in the next
April 5th or April 6th, I think, is when everything moves back into the ED, and so shortly after that we'll begin renovating that Mineral King wing.
So we're getting subacute ventilators, that canteen?
Yes, lightweight subacute ventilators. So over on Court Street, our 54-bed long-term care facility, unfortunately there are many patients, about 30, that are there for a long period of time. And many of them are ventilator dependent. They've suffered a horrific car accident or a stroke or some major catastrophe, and so they're going to be ventilated for the rest of their lives. So these new lightweight ventilators, much more comfortable for the patient.
Pediatrics decor in the ED.
God, you're doing great.
I'm great because Liz is chatting them out of.
Thank you. And bladder scanners, yeah. I'll do the bladder scanners first, yeah. So there's something called an Indwelling Urinary Catheter, which you probably all could imagine. We're all familiar. Yeah, it's probably not real comfortable, but unfortunately, a lot of our patients have to have a catheter for a period of time, and but these bladder scanners allow us to potentially not have to catheterize, if that's
that is right.
Is that the right?
I think so. Yeah,
I'm not sure.
Right.
But bladder scanners allow providers to be able to, assess and diagnose and potentially avoid having to place an indwelling urinary catheter. And then in the newly expanded ED area, 3 of the rooms there will be dedicated to pediatric care. And EDs obviously can be very frightening, even for adults, but for children in particular. So we want to furnish those 3 rooms and create decorate them in a fashion that is, not frightening for children. Right. That makes them, see characters or scenes that bring that calmness and look into that.
That's awesome.
Was that all 6?
That's
Liz?
great. Yes.
Okay.
Yes, we covered everything.
Great.
So
yeah.
Thank you. It's just good. There's hope. There's hope on the horizon. There's light at the end of the tunnel.
Yep.
We're feeling good. It's going to be a good day tomorrow, commemorating with our staff. So thank you guys so much for joining us for this webinar. And we will post this on the website a little later today. And we just appreciate you engaging with us in this manner. We're going on a year, and the first couple of times we didn't think we could make it, but thank you. Thank you, Gary. If you want
Yes.
to close it out.
No, you did a very fine job. So I echo everything Deb just said. And again, thanks for being here today, and we'll see you in a couple weeks.